Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we will discuss osteoporosis, a disease that weakens your bones. We will cover its symptoms, causes, risk factors, diagnosis, treatment, and more. Keep watching until the end because there is some truly valuable information for individuals with osteoporosis, individuals seeking information about the condition, or those who have a family member affected by it and are unsure of what steps to take. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is osteoporosis? Osteoporosis is a bone-weakening illness. It causes your bones to be thinner and denser than they should be. Bone fractures are substantially more common in those who have osteoporosis. Generally, your bones are dense and strong enough to sustain your weight and absorb most types of blows. Your bones naturally lose some of their density and capacity to rebuild, remodel, themselves as you age. If you have osteoporosis, your bones are much more frail and weaker than they should be. Most people are unaware they have osteoporosis until they break a bone. It can cause any of your bones to fracture. However, the most commonly affected are the hips, wrists, and spine, fractured vertebrae. The sooner a healthcare expert recognizes osteoporosis, the less likely it is that bone fractures will occur. Check your bone density with a healthcare practitioner, especially if you're over 65, have had a bone fracture after the age of 50, or someone in your biological family has osteoporosis. What are the symptoms of osteoporosis? Osteoporosis does not have symptoms like many other medical disorders. That is why healthcare experts refer to it as a quiet sickness. You will not feel or notice anything that indicates you may have osteoporosis. You won't experience a headache, fever, or stomachache to alert you that something is wrong with your body. The most typical symptom is unexpectedly breaking a bone, especially after a little fall or mishap that would normally not affect you. Although osteoporosis does not create symptoms, you may notice a few changes in your body that indicate your bones are losing strength or density. These osteoporosis warning signals include losing an inch or more of your height, changes in your natural posture, stooping or bending forward more, shortness of breath, if discs in your spine are compressed enough to reduce your lung capacity, lower back pain, pain in your lumbar spine. It might be hard to notice changes in your own physical appearance. A loved one may be more likely to see changes in your body, especially your height or posture. People sometimes joke about older adults shrinking as they age, but this can be a sign that you should visit a healthcare provider for a bone density test. What causes osteoporosis? Osteoporosis happens as you get older and your bones lose their ability to regrow and reform themselves. Your bones, like any other component of your body, are made of living tissue. Although it may not appear so, they are constantly replenishing their own cells and tissue throughout your life. They are living tissues and replenish their own cells and tissues all of your life. Until around the age of 30, your body naturally grows more bone than it loses. After the age of 35, bone breakdown occurs quicker than your body can repair it, resulting in a steady decrease of bone mass. When you have osteoporosis, you lose bone mass more quickly. Postmenopausal women lose bone mass at an even higher rate. Factors at risk for osteoporosis. Anyone can develop osteoporosis at any age. Some people are more prone than others to be impacted, including anyone over the age of 50. People who were assigned female at birth, AFAB, particularly those in postmenopause. People having a family history of osteoporosis, if someone in your biological family has the disease. Individuals that are naturally slim or have smaller frames. People with shorter statures typically have less natural bone mass, so any losses can be more severe. Individuals who smoke or use tobacco products. Some medical problems can increase your risk of developing osteoporosis, such as endocrine, any condition that impacts your parathyroid glands, thyroid gland, or hormones, for example, thyroid illness or diabetes. Diseases of the gastrointestinal tract such as celiac disease and inflammatory bowel disease. Autoimmune disorders of the bones such as rheumatoid arthritis or ankylosing spondylitis, arthritis of the spine. Blood disorders or cancers that affect your blood, such as multiple myeloma. Some drugs and surgical procedures can raise your chances of developing osteoporosis. Diuretics, medications that reduce blood pressure and remove excess fluid from the body. Corticosteroids, anti-inflammatory medicines. Medications used to treat seizures. Weight loss surgery, bariatric. Cancer hormone therapy includes treatment for breast and prostate cancer. Anticoagulants, medicines that help prevent blood clots. Proton pump inhibitors, such as those used to treat acid reflux, which might impair calcium absorption. Certain parts of your food and activity habit can increase your risk of developing osteoporosis, such as you are not consuming enough calcium or vitamin D. Insufficient physical activity. Drinking alcohol on a regular basis, more than 2 drinks each day. How is osteoporosis identified? A bone density test will be used by a healthcare provider to detect osteoporosis. A bone density test is a type of imaging examination that determines the strength of your bones. It uses X-rays to determine the amount of calcium and other minerals in your bones. DEXA scans, DXA scans, and bone density scans are all terms used by healthcare providers to describe bone density testing. All of these are distinct names for the same exam. A bone density test employs low-dose X-rays to determine the density and mineral content of your bones. It's similar to a standard X-ray. Because it is an outpatient operation, you will not be required to stay in the hospital. You may leave as soon as your test is over. This test contains no needles or injections. The best technique to detect osteoporosis before it causes a bone fracture is to monitor your bone density. If you have a family history of osteoporosis, are over 50, or have osteopenia, your provider may advise you to have frequent bone density testing. What is the treatment for osteoporosis? To manage osteoporosis, doctors aim to prevent bone fractures through a mix of treatments that reduce bone loss and strengthen existing bone tissue. The following are the most prevalent osteoporosis treatments. Exercise. Regular exercise can help to strengthen your bones and all the tissue that connects to them, such as your muscles, tendons, and ligaments. Weight-bearing exercise may be recommended by your clinician to strengthen your muscles and train your balance. Walking, yoga, Pilates, and Tai Chi are examples of anti-gravity exercises that can increase your strength and balance without placing too much strain on your bones. Supplements for vitamins and minerals. You may require over-the-counter or prescription calcium or vitamin D supplements. Your doctor will tell you which type you need, how often you should take it, and how much you should take. Osteoporosis medications. Your doctor will advise you on which medications are best for you and your body. Hormone therapy such as replacement estrogen or testosterone, as well as bisphosphonates, are among the most commonly used drugs to treat osteoporosis. People with severe osteoporosis or a significant risk of fractures may require drugs such as PTH analogs, denosumab, and romosozumab. These drugs are typically administered via injection. How can I reduce my chances of developing osteoporosis? Exercise and getting adequate calcium and vitamin D in your diet are usually enough to keep osteoporosis at bay. Your provider will assist you in determining the optimal combination of therapies for you and your bone health. To limit your chance of injury, follow these general safety guidelines. Wear your seatbelt at all times. Wear the appropriate safety equipment for all activities and sports. Maintain a clutter-free home and workstation to avoid tripping yourself or others. To access anything around the house, always use the correct tools or equipment. Never put your feet on chairs, tables, or countertops. Maintain a regular diet and exercise schedule. If you have trouble walking or are more prone to falling, use a cane or walker. How do I look after myself? Following a good diet and activity plan will help you maintain your bone and general health. Regular checks with a healthcare provider are recommended. They will also assist in detecting any difficulties or symptoms affecting your bones as soon as feasible. If you're over 65 and have a family history of osteoporosis, Talk to your doctor about getting a bone density test. How long can someone with osteoporosis expect to live? Osteoporosis is not lethal and will not affect your life expectancy, how long you will live. However, it can make you more likely to suffer a bone fracture, as well as increasing your chance of more serious breaks or fracture consequences. According to several research, hip fractures in persons over the age of 65 result in decreased mobility and an early mortality. The greatest method to avoid bone fractures is to detect osteoporosis early on. Inquire about how often you should have bone density testing and how often you should have follow-up tests to check your bone health. Now, watch this video to gain some valuable tips for maintaining a healthy lifestyle. Subscribe to the channel to receive regular health tips and guidance. That's all for now, and remember to stay healthy at all times. Thank you for watching, and we'll see you next time.